Mark Cuban has created an online pharmacy for the express purpose of providing generic drugs, expensive, big pharmaceutical drugs that people cannot get cheaper. This company that he's launching is finding a way to offer drugs at significantly, I'm talking drastically less money. Mark Cuban's announcement over the weekend of an online pharmacy selling over 100 generic drugs at near cost was totally unexpected, but will likely be welcomed by millions who struggle to afford medication. The billionaire told TechCrunch that the business model is refreshingly simple: lower prices, reduce patient stress, and that will lead to more customers. Interesting. The cost plus drug company aims very simply to provide as many common medications as possible in generic form, as low at as low a price as possible, all cash, no IP deals, no insurance company, just buy pills for what they cost to make, plus 15% to cover overhead. Asked about the return on investment, Cuban admitted there isn't much to speak of by design. Quote, "I want to be above break even while maximizing the number of people who could afford their medications. Shoot, I would be happy if we could make a little, but push pricing of generics sold elsewhere down significantly." So, Michael, we'll get to the fact that this obviously doesn't change the system, but just on what Mark Cuban's company supposedly does, what are your initial thoughts? Because it sounds like an amazing thing. I don't even know how Big Pharma, I mean, I would have thought Big Pharma would be doing everything they can to stop this, but what's your initial thoughts on what he's doing?
Well, it's very positive. It's, of course, getting people lower priced prescription drugs is a good thing. And I think that the fact that he's not selling prescription drugs with the primary motivation being profit, which is true even of generic companies, let alone the brand name manufacturers and distributors, is a positive because, of course, we've got way too much market for profit incentives and dynamics in prescription drugs as we have in the entire healthcare system. So, on principle, it's a much better approach. Lower prices, focus not on profits, but on a broad base of folks, serving a broad base of folks who need it. So that it's certainly in that sense a positive. Does it still in it try to solve the problem through a market-based approach? Yes, it does. And that's unfortunate. But again, when you take the profit motive out of that, it kind of balances the equation somewhat more favorably, I think.
And when he's saying, the simpleness of it, yeah, if we make it affordable, we think we'll just get more customers. We'll have so many more customers.
Right.
Let's say this was significantly successful, and I think it could be. Would that do a lot of damage to Big Pharma? And would Big Pharma have to start lowering its prices? How do you think that dynamic would play?
I think it would do damage to the generic sector. But keep in mind, where the big money is in brand name and especially specialty drugs. The ones you see marketed on TV are the ones that they make a lot of money providing, manufacturing and selling. So something like Trulicity, for example, a high-end diabetes drug that gets a lot of airplay on TV and commercials, you try to buy that just out of pocket on a monthly basis, and it's $1,300. This isn't going to impact that. It's not going to impact the big name drug manufacturers. It's going to put pressure on the generic sector. And in that sense, it's low hanging fruit because that's not where really the big money, the big profits, the big spending is. So I think it's going to be limited in terms of its impact on the pharmaceutical industry in general, and especially on the big name players.
And as he's doing this, Colin, I sent you this before. I don't know if you have it, but this is from the Wall Street Journal. Drug makers raised prices by 6.6% on average early this year. So that's just this year.
Right.
Drug 6.6%. The companies kept most increases in the single digits for another year as Congress explores measures to curb high costs, which we've been hearing that for the last 20 years, that they're going to curb higher costs. But drug makers raised list prices by an average of 6.6% in the first few weeks of this year on cancer, diabetes, and other prescription medicines, sticking with more moderate increases while lawmakers scrutinized pricing practices. So basically, it sounds like you're saying what Cuban's company is doing, it's going to address a lot of important drugs that people use, but not the most type of specialty drugs that he can't get his hands on.
Right. It's not gonna have, as we were suggesting, a systemic, change at the fundamental level about what we actually need to reorient the availability and cost and lower the cost of prescription drugs. It's not going to change it at the systemic level, and it's probably not going to impact the major manufacturers and big drug companies. But on the other hand, to the extent it is part of an environment that puts pressure on prescription drug prices, that shows that there are alternatives to how big pharma conducts its business and how it deprives patients of the medications they need, that's all to the good, because we do need a different, obviously, messaging and political context to really achieve fundamental reform. So Cuban puts pressure using some market mechanisms, lowering costs. Sure, that's going to have, I think, a ripple effect in terms of how the issue is viewed, how people experience it. And once patients have access to lower priced prescription drugs, that's going to impact the manufacturers. Ultimately, they're going to be under pressure to provide those drugs at lower cost. So I think he's onto something there. I mean, the Amazon pharmacy was an attempt to do that. Obviously, they have a non-insurance price. Seems like the Cuban model might be more aggressive and really taking the profit out and not relying upon the kind of exploitation, obviously, that's inherent in Amazon. So that's also a good thing. Putting, undermining the Amazon model could be an ancillary benefit as well.
Let me ask you a question. Yeah, just as I hear this, I really think a lot of this comes down to patent law. I mean, the length of time these folks are able to sit on a patent and extend a patent is absurd. Obviously, Mark Cuban has shown moments of time where he is very human, where he's very willing to be one of the people. I mean, he didn't come from the most high echelon. He came from the working class. This is a guy who I've seen at times for a billionaire. I mean, don't get me wrong, he's a billionaire, but for of the billionaires I've seen, he's one of the few people who seems to actually have some understanding of the struggle of regular people. I'm curious, given the fact that when Bernie tried to do the imports through Canada and you had Cory Booker deep six that basically. I'm curious, are we going to have a rotating villain here blocking this? Or do we have some other form of marauder that's gonna create havoc and block this? Because it seems like the Democrats always find a way to impact the good things that are happening out there.
Gee, I don't know why you're so cynical, Steve. I think that you're right. I mean, find out where the generic manufacturers are concentrated in the U.S., and you'll find the Congress member or senator who's going to push back on this, because that's the sector that's going to receive the heat. And I totally agree with you. Why aren't there diabetes medications available on a generic basis? Because they've manipulated the patent process so successfully, they don't sell them on a generic basis. So Lilly and Abbott and the rest of them can make tons of money. So until you change patents, and in fact, the truth is, as you know, the Biden administration has a lot of administrative power to deal with the patent issue, and how they could in fact determine that these drugs are overpriced, that their availability is denied, and that they can put pressure on those manufacturers and even go to what's called compulsory licensing and manufacture themselves in government facilities. So there is a lot of ability to actually directly hit this sector and their manipulation of patents. And until, I think a lot of the generic drugs, of course, are manufactured overseas. India is a big supplier, for example. So that may also be why this is more politically tenable, because it may not have the same impact domestically as some other approaches would.
Thanks for watching, and make sure to tune in to Status Quo's daily live stream Monday through Thursday at 5 o'clock Eastern Time and Fridays at 4 o'clock Eastern Time.